You're listening to Autumn on the Air, the weekly podcast that brings you conversations about the impact of research commercialization and the people who make it happen. Join us for interviews with patent and licensing professionals, innovators, entrepreneurs, and tech transfer leaders on the issues and trends that matter most. Keep listening for an inside track on the people, IP policies, and politics changing our world.
Welcome to Autumn on the Air. If you work in technology transfer, you know that discovery is only the beginning. The real challenge often comes in the earliest stages of development when science shows promise, but traditional capital isn't ready to step in. That space between breakthrough and investment can determine whether an idea moves forward or quietly stalls. Today's conversation is about how to close that gap. Joining me is Teri Willey, founding managing director of Pathway to Cures, the venture philanthropy fund of the National Bleeding Disorders Foundation. Over her career, Teri has led technology transfer offices at institutions like Cold Spring Harbor Laboratory and Mount Sinai, founded and managed venture funds, advised global investors, and served as president of Autumn. Few people have worked across as many parts of the innovation ecosystem as Teri. She's worked from the lab to licensing to capital formation, and now today, she's focused on using mission-driven investment to accelerate cures for inheritable blood and bleeding disorders. Welcome back to the podcast, Teri. It's really great to have you back on the air.
Great to be here. Thanks, Lisa.
Teri, since you last joined us on the podcast, you're in a new role now. So I thought maybe we would talk about your career across the innovation ecosystem to get things started today. Because you've led tech transfer offices, you've founded venture funds, you've advised investors, and now you run a venture philanthropy fund. When you look back at all this, what thread connects all this work?
There's a very strong thread that connects all of it, and that is acting at the interface of for-profit and not-for-profit organizations to commercialize early-stage science. So I've done this kind of work. It's my vocation, whether it's been from a chemical company early in my career to a university or as a venture fund that was investing in university spinouts. But the common thread is it's always acting at that interface of for-profit and not-for-profit to commercialize inventions, which is hard to get to work well. But when it does work, it's one of the most satisfying things you can be involved in.
So would you say your perspective on translation has evolved over time?
Maybe a little bit. I mean, one of the things that has occurred to me the longer that I do this is that science, finance, law, contracts, intellectual property, marketing, they're all critical to translation, but they're not sufficient. And the piece that has been maybe the gap in my formal training has been understanding human behavior. Because at the end of the day, you're trying to get a lot of very smart people with different perspectives and different objectives to work together on a common outcome. And people don't always behave in a way that seems logical or is predictable. So this area of human behavior and applying it in a way you can keep people focused on where they have that common interest so that you can compress the timeline of putting together good arrangements that have an impact. That's probably been the biggest thing that has occurred to me as I've, matured.
So do you have any good suggestions for us how to manage human behavior? Because I think that's something we can all benefit from.
I think it's just pay attention to it. It's not, some of us, like me, I'm very transaction oriented. I know that technology doesn't have a chance unless it's licensed into a company or that company gets invested in. But you do have to purposely pay attention, be a student of how are we going to have this discussion? How are we going to come to an agreement? And in text transfer, we do talk a lot about that in getting to yes, and how do you put together arrangements that take both perspectives into consideration. But really ramping that up, I think, is important.
So, for some of our listeners who might not be familiar with the term, how do you describe venture philanthropy and how is it different from traditional grant making or traditional VC?
Yeah, it can mean different things in different foundations, but for us and for a lot of the disease-specific foundations that have venture funds, it is a venture fund that's very similar to an early stage seed venture fund. One of the biggest differences is instead of, as in a traditional fund, you have limited partners that put money into the fund. And when after that money is invested and there's a return, those limited partners share in the profits. In a venture philanthropy fund like ours, the money comes from donors. So those donors make a donation to the foundation for this project, and they get the tax deduction on that donation. But all of the investment returns, we use that money to invest, to take ownership equity in early stage companies. And when that equity is realized, that money goes back to the fund. All of it goes back to the fund for reinvestment in further innovation. So big difference, limited partners versus donors. And then the other thing that's peculiar about our venture philanthropy fund is very, very specific to inheritable blood and bleeding disorders, looking for curative therapies or other approaches that can significantly impact the lives of people in the inheritable blood and bleeding disorders community, the patients, their families, the community.
Yeah, let's stick on that for a second. Talk to us a little bit about pathways to cures. You've mentioned a little bit about what it was designed to solve, but share with us a little bit more in detail about it.
It's a new fund. It's a new project for the National Bleeding Disorders Foundation. We've been at this for about 3 years now. It's a very small fund. We just have about $3 million under management. We've made 5 investments in early stage companies. Our first investment was a spin out from the Rockefeller University. So we are regularly looking to our tech transfer colleagues for opportunities that may be spinning out and so forth. We have looked at about 250 opportunities since we launched. Now, that's not a big pipeline in venture deal speak, but when you're looking at a very specific area, it's a lot of companies. We've met with all of them. And our objective has been to identify ones that we think are investment ready based on our criteria, but also we want to be a resource for all of them if they have the potential to impact our community. In some cases, we may suggest other partners for them or other investors for them, or we may give them feedback on their product development approach because there are so many nuances in the bleeding disorder area and to these different diseases under that umbrella. But it's a small team. There are 2 people that are employees of Pathway to Cures, and we leverage other people within the foundation. We have the benefit of administrative IT, HR support from the foundation as an affiliate. And we also rely heavily on volunteers. We have an amazing scientific advisory group that's made up of the thought leaders, the key opinion leaders in blood and bleeding disorders who help us review opportunities and advise these companies and innovators in our pipeline. And we also have a very traditional investment committee of a small committee of just some outstanding individuals that say, okay, this meets the criteria for clinical and science is solid, clinical potential is there. How do we structure this investment so it makes sense? So we have that as well. And then we report to our own board who are all volunteers as well. So it's small, but we, just leverage some of the best people in the community. And that's a pleasure.
It sounds like you have a lot of dedicated volunteers who really are very interested in this space.
And that's true. And they invest a lot in us and their time and their expertise and their networks. So our scientific advisory group, it's not unusual for them to meet once or twice a month. This is a big ask to hear presentations from companies, provide feedback, or to advise us on other aspects of the science and the clinic, or they may front for us at conferences where we won't have somebody there, but we want them to be at ASH or another hematology conference to keep an eye on things that might be coming up the pipeline. So yes, some of them are founders of biotech companies. Many of them, are just leaders in the field. And I think we think it's really important to keep them engaged. So we want to make sure that the window they're seeing, this window that they're seeing through to look at opportunities is interesting to them too. It's a way for them to stay on top of what's coming up the road. We often see opportunities that are still stealth. And of course, these decision-making bodies and volunteers are operating under confidentiality terms and conflict of interest policies and so forth. But we see a lot of opportunities. One we've invested in, and we've invested in it over a year ago, and it still hasn't been announced because they're finalizing partnerships. So we're seeing things that most funds won't see.
Very interesting. And there's a lot of information on your website. And one of the things that I noticed was a statement that it talks about that early stage funding gap is the biggest roadblock. Where exactly do you think the most promising therapies most often stall?
One of the places they stall is getting out of the laboratory, which we're all familiar with in technology transfer. But the area that we're focused on is primarily the seed and Series A stage. And it's been a especially challenging market the last year or so as well at the Series A stage. So this has been a real acid test for some of the companies in our portfolio and pipeline. And specific to bleeding disorders, there's just a lot of nuance in these diseases. So making sure that you do your preclinical and clinical design optimally, and very, very importantly, that you're including what we call lived experience experts. You're including patients and their families early at the preclinical stage. This is another thing that, another perspective that's really emerged since I started doing this role is how important that patient input is early. This was a common theme with the companies that we've met with. Is they're not engaging patients early enough. And as a result, it hurts clinical trial recruitment. They may be very successful in getting a product approved by the FDA, but it's not a product that is adopted. And so it's absolutely critical. It's a critical success factor for these emerging companies to engage with patients early. And we do have a mechanism for facilitating that at the foundation. So that's through our research group. And so we work closely with them to point companies at this. So it's this gap funding at the seed and Series A, and really knowing how to take those resources and leverage them at that preclinical and clinical stage in a way that takes patient perspectives in, because that can improve patient recruitment to trials and compress the timeline to getting a product on the market that patients want.
Now, I want to go back to something you mentioned before. You talked a little bit about how Pathway to Cure sits within the National Bleeding Disorders Foundation, but it operates independently. What advantages do you see with this type of structure?
The structure that allows us to be a little more autonomous is important just because we're a very different type of program than the foundation has had before. This is a foundation that's almost 100 years old. They've been leaders in advocacy and education, and in funding, hematologists early in their career, but doing investing in early stage biotech companies, it's a new activity. So being an affiliate of the main foundation provides us a little bit of autonomy so that we can carry out a different type of business decision process and to manage this type of asset ownership in a private company in a way that makes sense. But at the same time, we have the benefit of being a wholly owned affiliate of a 501c3 not-for-profit. We have the benefit of being supported by IT and HR and accounting as we carry out our work, so that Tim and I and our chief medical and scientific advisor can focus on those companies and those investments.
So what role do tech transfer offices play in making early stage projects visible to funds like yours?
I think about funds like ours as you would any other potential licensee or collaborator. You have this huge portfolio of assets, and you're always trying to think about who's the best licensee, and think about that and think about us in that context as you're going through those invention disclosures in your portfolio. If you have something in bleeding disorders and hemophilia and von Willebrand's disease and anemia and sickle cell and thalassemia, think of us. And even if we're not ready to invest in it, we may be able to identify a potential licensee or somebody who would sponsor research with an option to license, or give you some feedback about other ways this problem is being solved with other technologies. And we can do that, and so can these other disease-specific foundations.
Yeah, I think that goes back to something I've said a long time, that tech transfer community is so collaborative that even if you may not be able to invest in something, it's you might make that connection, that recommendation, that introduction, which is really, really vital, important. So I think, that's something we see time and time again.
And we have that in common with tech transfer offices, is that every single company that approaches us represents a constituent. So if we're going to say no, and we have to say no most of the time, we need to say no well, and we need to help in some way every time. And I know that our tech transfer community is in the same situation. Every disclosure that comes through the door, that is one of your constituents.
Yeah, you definitely can't file on everything that comes through your door, that's for sure. So going back to something that I mentioned at the beginning, you've led multiple tech transfer operations. So what do you wish more TTO professionals understood about how early stage investors evaluate risk?
I think it would be helpful for them to just understand the basics of what an investment memo looks like, or an investment case. And these are things that are not too hard to find. I think it's the best shortcut to learning about that, because basically what an investment memo is it says, these are the attributes that meet our criteria for investment, and these are the risks. And this is how our investment can mitigate those risks, or here's other ways those risks can be mitigated. But that type of kind of analysis of an top opportunity is really important. And then the other thing, when you're working with any licensee, a startup or an existing company, be really aware of how important a timeline is to get a license agreement done or to move things along. And internal decision paths can be complex sometimes, but that should be a high priority to sort that out and optimize it, because there's nothing worse than having a really great partner, having, some general agreement on terms, and then having the license agreement negotiation and finalization getting strung out because the decision path as to who has to approve and authorize changes and that type of thing, having those things be ambiguous can be really difficult.
So are there some ways you think that TTOs can maybe better anticipate maybe capital requirements earlier?
This is an interesting question. And when I think about it, I think about my tech transfer colleagues with huge portfolios. Very, very, might be a different strategy for each thing in the portfolio as to how you're going to get it commercialized. Some will be by licensing you to an existing company, some to a startup company. And the best way maybe to manage that, if it's a TTO that's got a startup unit, then that's great. You can collaborate with those folks. But each disclosure is different. And each, if it's a medical device, there's a different capital requirement. If it's a small molecule, it's a different capital requirement. If it's a platform that could be relevant to several rare diseases, it's a different deal. So again, putting yourself back in there with a varied portfolio and saying, what's the most legitimate shortcut to understand this? And you try to find a company or an investor that invests in the area and say, I'm not trying to take this to you because I'm looking for you to license it right now. I'm here to ask you, what would make this a valuable project to you? what criteria do I have to meet? What boxes do I have to check for this opportunity to be attractive to you? And I think asking those kind of questions of people in your network can, again, get you to the answer faster, sooner in a very practical way. And you make friends along the way, too.
Yeah, which is a great thing for sure. When we were talking about human behavior before, you mentioned, IP, and I'm curious, in a mission-focused fund such as this, do you think about IP any differently than in traditional venture capital?
We think about it like traditional venture capital. And we know that it's the start of the IP portfolio. And we often share due diligence with other investors when we're evaluating the intellectual property portfolio. We want to make sure that it's clear that this is the nugget we're going to build from, because once you start developing a product and you've got that imagined often spec of a product, then you have to start thinking about other aspects of your intellectual property portfolio. So I think that's the main thing, is that this is the initial nugget. It's got to be expanded on and be better. And all those good traditional tech transfer things, how do you collaborate on the filings to make sure that the best they can be? If it's a really early stage company, can you give a grace period before they have to reimburse costs? All those good things. So that's a long way of saying, we think about it like other investors and like other licensees.
Now, you mentioned earlier that Pathways to Cure's reinvest returns back into the fund. What does success look like beyond financial returns?
The success for us is having a curative therapy available to patients because of our efforts. And that could be because we've invested or we pointed somebody in the right direction. The effort to make returns and to bring those back into the fund is because this is a portfolio game. We're not going to get that cure right off the bat. We're going to have to place a lot of bets. We're going to be as smart as we can about it. And if we have some singles and doubles, we're going to plow them back in and support more innovators. And the ultimate outcome is that we end up investing in a platform that turns out you can plug and play and cure every factor deficiency, and we put ourselves out of business. I mean, that would be success.
That would be ideal, wouldn't it? Put yourself out of business. That's the ultimate goal. And it's interesting because we are seeing more disease foundations entering this venture space. So given your experience, Teri, I'm curious, what do you think the future of foundation-based investing is going to look like?
I hope it grows. I'm really grateful to those disease-specific foundations that have led the way, like the Cystic Fibrosis Foundation and the T1D Fund and the Muscular Dystrophy Group. They've really shown us how it works. And I'm hoping there'll be more of it if people invest and there are returns. Most of these are set up as evergreen funds that allows that to grow. And like in tech transfer, we share learnings. We emulate other organizations that seem to be doing it well. We learn from each other. So I hope it continues to grow. And I was wondering about one aspect of this when I was trying to decide whether to jump on board to help with this fund. And that was, do traditional venture investors value having a disease-specific foundation investment alongside them or following it? Is that attractive to them? And under what circumstances? So I talked to my friends at Versant and Arch and said, what about this? Do you guys care if there are disease-specific foundation groups, especially if they're not writing big checks, but they, know a lot about a disease? And the answer is generally yes, because of their understanding of the patient population and their access to patients, the ability to reach out to them to get feedback. That's very valuable. And because of the nuance with the disease and their relationships with key opinion leaders. So yes, in general, it can be very valuable and they can be seen as valuable members of a syndicate. However, if they insist on terms or side letters that are weird and creepy, then no. And you need to do your investing in a professional way alongside other investors. So I think it's really really interesting from that perspective. But in general, we've been very well received by the traditional funds that we're investing alongside.
So given the evolution of this particular landscape, what role do you think tech transfer professionals can play?
Again, continue to see us among those potential partners. So as you are working with that faculty member, and the first time you meet with them and they talk about their innovation or their invention, and you're asking yourself, who's the right partner to commercialize this? Who's the licensee? So you can start back engineering into what you need to do. I mean, that who you imagine as the licensee or partner frames how you do the intellectual property protection, frames how you want to do the licensing, whether it's an existing company or a new one. So think of us as a resource like you would one of your pharma colleagues, as somebody to reach out to you when you have something that's in our space to say, what would make this an interesting product to you and to the network you're in? What do I need to know about this? That's a good way for us to work together.
Now, Teri, you've spent decades helping move ideas from the lab to market. I'm curious, what keeps you optimistic?
Well, I'm generally an optimistic person, but the main thing is that this is hard. And when you look at all the barriers to commercializing something that's developed at an early stage from basic research at an academic laboratory and having it reach the public, through commercial channels, it's really hard to get it right. There are so many things that can go wrong, and markets are in flux. The amount of litigation in this space is always increasing. The complexity of the deals we put together are phenomenal. The resources to do tech transfer and early stage investing are not keeping up with the demand. And the amount of funding for research is at risk. Yet, every year, more inventions are made, more patents are filed, more good license agreements are put in place with existing and emerging companies. And those products are reaching the market in a meaningful way and making a difference in people's lives. And that trend is increasing despite all the barriers. And that's really encouraging. In fact, it's amazing. And it's one of those things where this year and last year especially, we were just getting hit with one thing after the other. And these things would come up. We didn't know the answer to them, but something was clear is that the answer would occur to us and we would figure it out. We would figure it out together. And we do. And the proof is in the impact.
I think that's very well said, Teri. And thank you so much again for visiting us on the podcast. It's always a pleasure to talk to you. Thank you for your time.
Thanks for including me, Lisa.
Teri, thank you for bringing such a thoughtful perspective to this conversation. It's rare to speak with someone who has worked across tech transfer, venture creation, institutional strategy, and mission-driven capital at this level. For our listeners, we'll include links in the show notes to Pathway to Cures and the National Bleeding Disorders Foundation. If this episode sparked ideas about how early-stage capital and technology transfer can work more closely together, we encourage you to continue this conversation within your own institutions. Thanks for listening, and we'll see you next time on Autumn on the Air.
Thanks for listening to Autumn on the Air with Lisa Mueller. Get social with us and share your thoughts. You can tweet us at AUTM or visit us online at autm.net. We'll be back next week on the air. Be sure to join us.